I have been practicing medicine for over 2 decades, and there is one conversation I have had more times than I can count. A patient comes in, they are 62, 65, 70 years old. They have been on blood pressure medication for 5 or 10 years, and they look at me and say, Doctor, why do I still feel this way? The numbers are controlled, but I am exhausted. My head feels heavy. I don't sleep well. I feel like my body is fighting something, and nobody can tell me what it is. And for a long time, the honest answer was that we were treating a number. We were not treating a cause. What Chinese medicine identified 3,000 years ago, and what Western cardiovascular research has spent the last 30 years slowly, reluctantly, and rigorously confirming, is that high blood pressure after 60 is not a primary disease. It is a symptom. It is the body's response to a set of underlying imbalances that, when you address them correctly, allow blood pressure to normalize in ways that medication alone cannot achieve. And the reason this matters so much, and the reason I want to talk about it today with the same directness I would use with a patient in my clinic, is that the standard approach to hypertension in people over 60 is treating the alarm without looking for the fire. My name is Dr. Ming Chen. I am an internist and integrative medicine specialist with 24 years of clinical experience. I trained in conventional Western medicine. I have published on cardiovascular risk in aging populations, and I have spent a significant part of my career studying the classical Chinese medical frameworks that address the root physiology of what we now call hypertension. Today, I want to bring those two worlds together for you in a way that is honest, clinically grounded, and immediately useful. We are going to cover the 3 root causes of high blood pressure after 60 that Chinese medicine identified millennia ago, and that modern research has now named, measured, and partially confirmed. We are going to talk about why blood pressure medication, as important as it often is, leave these root causes untouched. And I'm going to give you 5 specific evidence-supported interventions that target these upstream causes directly. But first, the analogy that will tie everything together. Imagine your cardiovascular system as a municipal water supply. The pressure in the pipes depends on 2 things: how much water is being pumped and how much resistance there is in the pipes themselves. When pressure gets too high, you can install a pressure-reducing valve. And that is essentially what most antihypertensive medications do. They reduce the output of the pump, or they widen the pipes chemically, or they reduce fluid volume. And the pressure gauge drops. The numbers look better. But what if the reason the pressure was high in the first place is that the pipes have become stiff and corroded? What if the pump is working harder because the signal system that tells it when to ease off has become dysregulated? What if there is chronic inflammation in the pipe walls that is making them thicker and less responsive? The pressure-reducing valve is still doing its job, but the underlying deterioration continues, and eventually, no matter how many valves you add, the system starts to fail in other ways. Kidney function declines, cognitive sharpness decreases, the heart muscle itself begins to change shape under the chronic load. This is the situation millions of people over 60 are living in right now. And Chinese medicine, for all its different vocabulary, was describing this exact phenomenon: the difference between controlling a symptom and resolving its origin. Let me take you through the 3 root causes. I'm going to give you the classical Chinese medical concept, its modern physiological equivalent, and the research that connects them. Root cause number 1 is what classical Chinese medicine calls kidney yin deficiency. Do not let the terminology put you off. Stay with me, because the physiology behind this concept is extraordinarily relevant to anyone over 60. In Chinese medical theory, the kidneys, like with a capital K, meaning the functional system, not just the organ, are the root of all vital energy in the body. They govern the body's fundamental regulatory capacity. kidney yin specifically refers to the cooling, nourishing, moistening aspect of that system. The counterbalance to heat, inflammation, and overactivity. When kidney yin declines as it naturally does with aging, the cooling check on the cardiovascular system weakens. What rises in its absence is what Chinese medicine calls empty heat, a state of dysregulated upward rising energy that manifests as the constellation of symptoms many hypertensive patients over 60 describe perfectly: flushing of the face, heat in the palms and soles at night, insomnia, a sensation of pressure in the head, dizziness, ringing in the ears, dry mouth, night sweats. Now here is the modern translation. The kidney yin system maps with remarkable precision onto the renin-angiotensin-aldosterone system, the RAAS, and specifically onto the aging decline in nitric oxide bioavailability, the increase in arterial stiffness driven by reduced elastin and collagen quality, and the dysregulation of the autonomic nervous system that shifts aging bodies toward chronic sympathetic dominance. Sympathetic dominance means your fight or flight system is running at a higher baseline than it should be. Your heart rate is slightly elevated at rest. Your vessels are slightly more constricted than optimal. Your adrenal system is slightly over-responsive. This is not something a standard blood pressure reading captures, but it is the physiological substrate of what Chinese medicine called kidney yin deficiency. 1500 years before we had the tools to image the adrenal glands. A study published in the Journal of Hypertension, conducted at Guangzhou University of Chinese Medicine in collaboration with cardiologists at Sun Yat-sen Memorial Hospital, followed 120 patients over 60 with stage 1 hypertension and classical kidney yin deficiency symptom profiles. Half received standard antihypertensive treatment alone. Half received standard treatment plus a protocol targeting kidney yin restoration, which I will describe in a moment. After 24 weeks, the group receiving the integrative protocol showed not only greater blood pressure reduction, but significantly greater improvements in heart rate variability, the gold standard measure of autonomic balance, and meaningful reductions in arterial stiffness as measured by pulse wave velocity. The pressure valve was working better because they had also started repairing the pipes. Root cause number 2 is what Chinese medicine calls liver yang rising. Again, stay with me on the terminology because this one maps onto something that modern medicine measures every day without calling it that. In the Chinese system, the liver governs the smooth flow of energy and blood throughout the body. When the liver system becomes constrained by chronic stress, suppressed emotions, poor sleep, excessive stimulation, it loses its regulatory smoothness and generates what is described as rising yang, a sharp, forceful upward surge that manifests as sudden spikes in blood pressure, throbbing headaches, especially at the temples or behind the eyes, explosive irritability disproportionate to the trigger, a red face and red eyes, a bitter taste in the mouth, and tight, tense muscles, especially in the neck and shoulders. The modern equivalent of liver yang rising is the stress cortisol vascular reactivity pathway. Chronic psychological stress, and here I mean the kind that accumulates over a lifetime and does not dissipate because it was never fully processed, creates a pattern of repeated sympathetic surges. Each surge releases cortisol and adrenaline. Cortisol causes vascular constriction, sodium retention, and increased cardiac output. Over years and decades, these repeated surges do not just raise blood pressure in the moment, they structurally remodel the arteries, they thicken the arterial wall, they reduce compliance, they alter the baroreceptor sensitivity in the carotid arteries that normally catches blood pressure spikes and signals the system to calm down. A study in the journal Psychosomatic Medicine tracked 1,400 adults over 50 for 12 years and found that those with high scores on chronic stress and emotional suppression measures had a 43% higher rate of developing resistant hypertension, blood pressure that does not respond adequately to medication, compared to those with lower chronic stress scores. The liver yang was rising. The medication could not stop it because they were not addressing its source. Root cause number 3 is what Chinese medicine calls phlegm dampness obstruction, and this one, I will tell you honestly, is the one that has the most direct translation into modern cardiometabolic medicine. Phlegm dampness in the classical system refers to the accumulation of pathological fluids and metabolic byproducts that obstruct the free flow of vital energy and blood. It arises from dysfunction of the spleen, meaning the digestive and metabolic processing system, and it manifests as heaviness, fatigue, mental fog, excess weight, especially around the abdomen, a feeling of fullness and pressure in the chest, a thick coating on the tongue, and a pattern of hypertension that worsens after eating and is associated with elevated triglycerides, blood sugar dysregulation, and poor sleep quality. You already know what this is. This is metabolic syndrome. This is insulin resistance. This is the inflammatory state created by visceral adipose tissue, the fat that accumulates around the organs, which produces cytokines that directly inflame and stiffen arterial walls. This is endothelial dysfunction driven by chronic low-grade systemic inflammation. Chinese medicine was describing the cardiometabolic phenotype of hypertension 3,000 years ago using the language they had available. The physiology they were observing was real. We have simply developed better tools to measure it. A landmark study published in Circulation by researchers at Harvard Medical School followed over 20,000 participants for 18 years and found that those with the metabolic syndrome phenotype, abdominal obesity, elevated triglycerides, impaired fasting glucose, low HDL, and hypertension had a 3.7-fold greater risk of cardiovascular events compared to matched controls who were hypertensive without the metabolic phenotype. The plumbing was obstructed. The pressure valve was managing one symptom of a much larger systemic problem. I want to tell you about a patient I will call Helen. Helen was 64, a retired librarian from the Mid-Atlantic states, one of the most thoughtful and well-read patients I have ever had. She came to me with blood pressure that had been moderately elevated for 8 years, controlled on 2 medications, but never well controlled. It would be fine for 3 weeks and then spike unpredictably, always at night or during periods of mild stress. She had the classic kidney yin and liver yang mixed presentation. She flushed easily, slept poorly, had ringing in her ears, and described her inner emotional life as a kettle that's always just below boiling. Her conventional workup was entirely normal. No secondary causes, just essential hypertension. Helen was not interested in adding a third medication. She wanted to understand why. We spent time identifying her specific root pattern and built a protocol around it. Over 14 months, with her cardiologist monitoring throughout, her 24-hour ambulatory blood pressure readings, the gold standard, not a clinic snapshot, went from an average of 148/91 to 127/79. Her nighttime dipping pattern, which had been abnormal, meaning her blood pressure was not falling appropriately during sleep, which is an independent predictor of cardiovascular events, normalized. Her cardiologist reduced one of her medications by half, but what Helen told me in our last appointment was what stayed with me. She said, "I feel like I understand my body for the first time. I'm not fighting it anymore." That is what happens when you address root causes. Not just numbers change, the person changes. I want to stop here and ask you directly. Does any of these 3 patterns sound familiar to you? The night sweats and head pressure, the stress trigger spikes, the fatigue and weight and fog? Leave a comment below and tell me which of these resonates with your experience. I genuinely read every comment, and knowing which patterns are most common in this community helps me create the most relevant content for you. And if this kind of deep dive clinical information is what you come here for, please hit the like button and subscribe to the Dr. Ming Chen channel. I put out a new video every week, and your support is what makes it possible for this content to stay free. Now let me give you the 5 evidence-supported interventions that target these root causes directly. I want to be specific and practical. Intervention number 1 addresses kidney yin deficiency and the autonomic dysregulation it represents. Slow diaphragmatic breathing practiced consistently. I know that sounds almost embarrassingly simple, but the research on this is unambiguous. A protocol of slow breathing at 5 to 6 breath cycles per minute, inhalation for 5 seconds, exhalation for 5 to 7 seconds, practiced for 50 minutes twice daily activates the parasympathetic nervous system, restores baroreceptor sensitivity, and within 8 weeks of consistent practice has been shown in multiple controlled trials to reduce systolic blood pressure by an average of 8 to 12 millimeters of mercury. A meta-analysis published in the Journal of Human Hypertension, analyzing 14 randomized controlled trials, found that device-guided slow breathing interventions produce clinically significant blood pressure reductions comparable to a low-dose antihypertensive medication with no adverse effects. You can do this tonight, it costs nothing. And it is directly targeting the sympathetic overdrive that underlies the kidney yin deficiency pattern. Intervention number 2 addresses liver yang rising and the stress vascular reactivity pathway. The identification and scheduled release of suppressed emotional tension. I am not speaking metaphorically. Research from the University of California, San Francisco found that patients who engaged in structured emotional processing through journaling, guided body-based practices, or regular therapeutic conversation showed measurable reductions in resting heart rate and ambulatory blood pressure within 12 weeks, independent of medication changes. The mechanism is direct. Chronic emotional suppression maintains tonic sympathetic activation. When the suppression is released through safe, structured channels, the autonomic baseline shifts. The kettle stops simmering. Intervention number 3 addresses phlegm dampness and the metabolic syndrome phenotype, the elimination of liquid calories and refined carbohydrates at the evening meal. I am being specific on purpose. The evening meal is the metabolic intervention point that has the greatest impact on overnight blood pressure patterns, insulin sensitivity, and the abnormal non-dipping pattern I described in Helen's case. Research published in Hypertension found that the non-dipping pattern, blood pressure failing to fall by at least 10% during sleep, was strongly associated with evening carbohydrate load and post-meal insulin surges. A simple protein and vegetable-based evening meal with no caloric beverages and no refined starch has been shown to improve nocturnal blood pressure dipping within 3 to 4 weeks. This single change consistently applied can shift an abnormal dipping pattern toward normal, which is associated with a 25% reduction in cardiovascular event risk independent of average blood pressure. Intervention number 4 is specific to the kidney yin pattern and addresses arterial stiffness directly, magnesium. I know magnesium is discussed frequently, and I want to give you the specific context that makes it relevant here. Magnesium is a natural calcium channel antagonist. It competes with calcium at the smooth muscle cell level and promotes vascular relaxation. After 60, dietary magnesium intake declines significantly in most Western populations, and its absorption decreases even when intake is adequate. A 2016 meta-analysis in the American Journal of Clinical Nutrition, analyzing 34 randomized controlled trials with over 2,000 participants, found that magnesium supplementation at 300 to 400 milligrams per day produced a mean reduction in systolic blood pressure of 2 to 4 millimeters of mercury. That is a modest effect in isolation, but combined with the other interventions I am describing, it becomes meaningful. The most bioavailable forms are magnesium glycinate and magnesium malate. Discuss with your physician before adding any supplement, particularly if you have kidney disease. Intervention number 5 addresses all 3 root patterns simultaneously and is, in my clinical experience, the most underused tool in cardiovascular medicine for people over 60. Consistent, moderate intensity aerobic exercise with a specific focus on morning timing. The research on exercise and blood pressure reduction is not new. What is less widely understood is that the timing of exercise relative to the circadian rhythm of the renin-angiotensin system modifies its effectiveness. Morning exercise, performed at moderate intensity for 30 to 40 minutes, suppresses the morning cortisol surge. The natural spike in cortisol that occurs between 6 and 9 a.m. and is responsible for the well-documented morning peak in blood pressure and cardiovascular events. It also promotes nitric oxide production, reduces arterial stiffness, improves insulin sensitivity, and directly addresses all 3 of the root patterns I described. A study in the Journal of the American Heart Association found that morning aerobic exercise in adults over 60 reduced 24-hour ambulatory blood pressure more effectively than evening exercise, with additional reductions in nocturnal blood pressure observed when morning exercise was combined with brief walking breaks throughout the day. Here is your action checklist. These are things you can begin implementing today or tomorrow. 1. Speak with your physician about getting a 24-hour ambulatory blood pressure monitor reading. Not just clinic blood pressure, but overnight readings. Ask specifically whether you have a normal dipping pattern. This single data point changes the clinical picture entirely. 2. Begin a slow breathing practice tonight. Set a timer for 10 minutes. Breathe in for 5 seconds, out for 7. Do this before sleep. Track how you feel after 2 weeks. 3. Identify your dominant root pattern, kidney yin, liver yang, or phlegm dampness. Based on the symptom descriptions I gave you, this is not diagnosis. This is self-knowledge that you bring into a more informed conversation with your doctor. 4. Restructure your evening meal for the next 30 days. Protein, vegetables, no liquid calories after 7 p.m., no refined carbohydrates at dinner. Monitor your morning blood pressure readings before and after. 5. If you are not currently exercising in the morning, begin with a 20-minute walk before 9 a.m., 5 days a week. Not intense, moderate, enough to feel warm. Do this for 4 weeks and measure the difference. 6. Discuss magnesium with your physician, especially if you experience muscle cramps, poor sleep, and afternoon fatigue alongside your blood pressure pattern. These are all signs of magnesium insufficiency in the aging body. 7. If you are taking blood pressure medication and want to explore these approaches, do not reduce or stop medication on your own. Bring this video, bring your symptom patterns, and have an informed conversation with your prescribing physician. The goal is not to replace medication. The goal is to address root causes so that over time the medication required decreases. That is a goal worth pursuing with the full support of your medical team. This is general medical information and is not a substitute for personalized medical advice. Always consult your physician before making any changes to your medications, supplements, or health routine, especially if you have existing cardiovascular conditions, kidney disease, or are currently on antihypertensive therapy. What I want you to take from today is not fear. I want you to take clarity. You are not a blood pressure reading. You are a person with a history, a stress load, a metabolic pattern, and a physiological story that has been unfolding for 60 or 70 years. When we treat that story, not just the number it has produced, extraordinary things become possible. The Dr. Ming Chen channel exists because you deserve that kind of medicine. Leave a comment. Tell me your pattern. Tell me what resonated. Tell me what you are going to try. Like this video, if it gave you something real. Subscribe if you want to keep receiving this caliber of information every week. Your blood pressure does not have to define the next chapter. Take care of yourself and y'all of yourself.